Hi everyone, my name is Dinesh Surasena and I'm a consultant in sports medicine. I use ultrasound regularly in my clinical practice and I want to share with you some of the things I've learnt along the way. Today we're going to be talking about the acromioclavicular joint and undertaking ultrasound imaging of it. Here are a couple of resources that I would fully recommend using, particularly when you're giving talks or undertaking teaching. The first is the ESSR guidelines for upper limb and particularly shoulder scanning, and the second is the website ultrasoundcases.info. Here's the images from the ESSR guidelines. In the picture we have the transducer positioned in a long axis orientation over the AC joint, and on the ultrasound what you'll see is the clavicle, the acromion, and the joint space in between. Personally, when I'm scanning the acromioclavicular joint, particularly when considering an injection, I use the hockey stick transducer. This is very useful for superficial structures, and the acromioclavicular joint certainly is one of those. You can have the patient sitting upright, as in one of the images here, or they can be lying down. The advantage of having the patient lying down is that it's more comfortable for the patient, but also the image and holding the transducer will be a lot more stable for you. Here are some examples of the acromioclavicular joint scanned using a hockey stick transducer. You can see that the acromion and the clavicle are very clearly defined and the bony contours are visible. Equally, you could almost see the joint capsule itself sitting over the joint. Here are some further examples of the acromioclavicular joint. In these, you can see that the joint capsule is bulging upwards and there is a little bit of thickening of it as well. This could be as a consequence of some sort of pathology, or it could be a normal variation due to progressive loading of the shoulder and so forth. Here's an example of a synovitis of the acromioclavicular joint. As you can see and compared to the previous images, the joint capsule is very prominent, there's significant hyperechogenic changes overlying it, and there's also neovascularity. In situations where you're concerned about gapping or separation of the AC joint, it's useful to try and load the shoulder. When I say load the shoulder, what I mean is ask the patient to have the hand in a supinated position and the elbow bent to 90 degrees. Then ask them to push up against your hand, and if there is significant separation of the AC joint, you will see this and it will be quite evident on the ultrasound image. I hope you enjoyed the video and it adds to your knowledge of ultrasound imaging and interventions, and I hope you can use it in your clinical practice. If you did, remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter and Instagram, and can also check out sportsmedinfo.com.sg. I hope to see you all very soon. Take care.